Hi, my name is Saba Shaikh. I'm a breast medical oncologist at UT San Antonio, and I'm joined here today by...
I'm Sonia Pernas, also a breast medical oncology at Catalan Institute of Oncology in Barcelona, Spain.
Well, thank you so much for joining us for our SABCS Snippets. We'd like to hear a little bit about the study that you presented today, the SUMIT-BC. Can you tell us a little bit about the overview of the study and the findings that you have?
Sure. This is a Phase II clinical trial, international, randomized, open label, this oral CDK7 inhibitor in combination in fulvestrant versus fulvestrant alone. And in patients, it's a second pure line in patients with ER-positive, HER2-negative disease that has received a prior line with an aromatase inhibitor and a CDK4/6 inhibitor. And there was also prior data, clinical data in heavily pretreated patients that the combination was of fulvestrant plus samuraciclib. This oral CDK7 inhibitor had activity and with a safety profile okay. And this is like a phase 2, as I said, randomized 1:1 to the dose of 360 milligrams of samuraciclib or 240 milligrams, both in combination with fulvestrant versus fulvestrant alone. And because prior data showed that those patients with TP53 mutation didn't go well, the certification was in terms of presence or not of P53 mutation or presence or not of liver metastasis. And the primary endpoint was clinical benefit at 24 weeks, but also as secondary endpoints was progression-free survival, overall response rate, and duration of response.
That's a wonderful overview. Thank you so much. And what did you find as your primary endpoint?
We find that the combination, both doses of samuraciclib in combination with fulvestrant was a very active drug combination, because in terms of clinical benefit rate, like 40% in the fulvestrant alone arm versus more than 60% in the combination arm. But importantly, all secondary endpoints like progression-free survival and overall response rate were higher in the combination arm, and especially in those patients without TP53 mutation, we can see differences with almost double the progression-free survival, 7 months for the fulvestrant alone arm versus more than 14.5 months, so more than double. So these data are consistent, not only in the primary endpoint of clinical benefit rate, but also overall response rate and, importantly, progression-free survival. So, and we have a biomarker that it's a P53, so a novel drug with a clear biomarker.
That's fascinating. Can you tell us a little bit more about CDK7 inhibitors, how they differ from CDK4/6 inhibitors?
Sure. The CDK7 has an important role in the phosphorylation of other CDKs in the cell cycle, like CDK2, CDK4, CDK6, and also it has an important role of the inactivation of P53. So there's a lot of background and with the rationale of the combination. Samuraciclib, as I said, is a small molecule, CDK7 inhibitor developed by Carrick, and this clinical trial was Carrick and a partnership with Pfizer it was carried out.
And where is this drug headed? What are the next steps?
Next steps, because of this promising and consistent data, is to go ahead with a phase 3 clinical trial and see the combination with an arm with probably not fulvestrant alone, as we see. No, now there's the second and beyond line. It's a lot crowded with a lot of novel drugs, but it has his space. And it's important to develop this phase 3 clinical trial to compare with endocrine therapy plus mTOR inhibitor, or we'll see which is comparable arm, but for sure very promising results, and that we need to go, because it's true that this is a small phase 2 clinical trial with almost 60 patients. So we have to see if this compared with a phase 3 clinical trial, and see exactly if it's it's also demonstrated in the phase 3 clinical trial. So,
well, that's wonderful, and we eagerly await those results. Thank you so much for joining us today on SABCS Snippets.
Thank you very much.